down to how do we create great experiences for those patients who put their hands up and say, I'd like to hear about clinical trials. So those familiar challenges, I think, are the heart of this, right? We all know that it's difficult to find that right patient. That it's a needle in a haystack problem. And, we've all heard this. We hear it at the level of sponsors. We hear it at the level of our friends in the CRO space that are actually turning on the sites to get them activated and get them going, trying to make those difficult decisions about, do they have a sufficient population base around them and a sufficient record in this space that they could be successful. And we certainly hear about it from the site space, who actually do the hard work of combing through electronic medical record data, their previous patient lists, the local advertising and local recruitment to make this all work. It is a needle in the haystack problem. And then even when you find the needle, you have the challenge of that particular patient saying, I appreciate you bringing this to my attention, but I don't understand it well enough. It logistically feels too complicated. I don't think I have what I need to be engaged and support and participate. So, I always, without demoralizing people, I like to point out that it's tougher than a needle in a haystack problem, because even when you find the needle may say no thanks. And so that has to be taken into account. And I think the experience that people have on that journey towards that research site to hear about this is a lot of opportunity for improvement that could improve the yes rate and that yield of all that digital conversion. I do think that as we head into an era of greater and greater protocol complexity, one of the heartening elements of this is we are also potentially now heading truly into an era of hybrid trials too, where that decentralized component can take some of that burden off. But the protocols themselves, the amount of data collected per patient, all of that has been exponential for a couple of decades now. And so that really creates a challenge at the level of the site. And I want to be clear that we can show that challenge at the level of the site reflects backwards into the protocol. High screen fail rates, patients either dropping out or not consenting at the rates required to allow trials to get done efficiently. And so the idea is that there's insufficient support on that journey for the patient to make that choice. And so while we have digital outreach, which is terrific, and I think it's been one of the real success stories of the clinical trials industry over the last 20, 25 years, we are solid at creating awareness across a large population that will convert to even clicking on the ads and filling out the microsites. I think that's been a huge win in terms of finding patients who'd be reasonable to engage clinical trials. The challenge is that it's still not sufficiently filtered to allow an efficient experience at the site, both for the study team with its limited resources, and I think most importantly, for the patient trying to make that difficult choice, especially when we consider there's so few that do qualify. So getting the few who do qualify to feel good about the opportunity and to understand it fully, they can make that decision to say, yes, I do want to participate because I see what value this affords me. So what's nice about that is those challenges haven't changed in years. And what's fun about being sort of in this seat at Circuit is because we spend a lot of our time with sponsors, we spend a lot of our time with CROs, we spend a lot of our time in the industry, but we also spend a lot of time at sites, both sites inside our network and our friend sites, and we spend a ton of time with patients. We sort of hear this from the full 360. We've over the last 2 years of scaling MD PreScreen, we've spent a lot of time with our friends in the patient recruitment space. And so, each one of these perspectives shows an opportunity for real new value in the space. And so if you talk to coordinators, they will just say the same thing over and over again about this, which is that much of their day is spent not taking care of study participants, but it's spent with not even with data processing, like making sure the EDC is up to date. It's spent with things like contacting and scheduling and trying to prioritize the referrals that are coming in. The challenge with having a very successful digital campaign that is insufficiently filtered is you will end up sending a lot of people who will not qualify to the site, and the site doesn't have an additional mechanism for being certain about this except what they do on their own time, which again adds to burden. And what happens in those situations is sites either say, hey, listen, we're going to deprioritize the study because I don't think we're going to be able to figure out who should be called to come in, or they're going to spend a lot of their time and energy on a study and say, hey, that wasn't a really productive study for us, actually. We thought it would be a good experience and it would be a positive business move and positive for our patients, but it turned out that it was just too difficult to execute. Or they're going to take it all on, but it's going to slow down the actual processing of the actual patients who should be enrolled. So this is that complaint that